For the next hour and a half, we will be focusing on promising practices, and specifically promising practices that support refugee integration in our community. We have wonderful speakers this afternoon, and I want to call up first our first speakers, who are Dr. Buma Bayana and Dr. Natalie Lovesey, who will be speaking about the health needs of refugees. Both are community family physicians and adjunct professors of family medicine at Western University. They are very well known in the community for all the work that they do, and particularly most recently for their work with the Newcomer Health Project, which is a refugee clinic here in London at which medical students volunteer and provide support. So if I can ask you to come up, you will have about 15 minutes plus time for questions.
Hi, thank you so much for having us here today, and thank you to the organizers for organizing this conference. I've had the opportunity to attend Life as a Refugee before, and I think it always is energizing to see so many people doing such amazing work within this community. And certainly our work with the Cross Cultural Learner Center has really humbled and impressed us, because all of the people we work with at CCLC are so committed to working with refugees, even when they're inundated and overwhelmed as they have been in the past year. So I'm going to just talk a little bit first about how we began the Newcomer Health Program. We began the Newcomer Health Program really out of two conversations, and one was a conversation with a settlement worker at CCLC who at that time had lamented that there was very little ongoing care for government-assisted refugees when they arrived, that it was really stopgap care, that it was difficult to get into a family doctor, and that people were being taken to walk-in clinics and there wasn't a continuity. And the second conversation was with a medical student who said that there was very little about cultural competency within their curriculum and little opportunity to work with a multicultural community, and yet they would be expected to grapple with issues around cultural competency when they practiced. Around the same time, there was an article in the Canadian Family Physician, our national family practice journal in Canada, in which Dr. Kevin Potty in Ottawa described a program that he had there. And this project really combined the efforts of community family physicians and teachers, medical students, and the settlement agency in Ottawa, and essentially developed a program that was a win-win situation where medical students had an opportunity to learn how to work in a culturally diverse environment, and new refugees had an opportunity to have health screening and to have connection with care upon arrival. And so we decided to replicate that effort here in London. And we began as a very, very fledgling sort of operation within the Cross-Cultural Learner Center. In one of the rooms in Jeremiah's house, we've got a little exam room built in with an exam table and instruments. And so we began there, and then later progressed to have a clinical home within the London Community Health Center. So the objectives of the program are really fourfold. The first is initial health screening, but more important than screening is addressing the needs of newcomers when they arrive. So very often when people arrive, they've had interruption in the care of chronic disease, and others have not been able to access even screening and come with undiagnosed conditions. The second is connecting people to care. For example, people may have had diabetes or high blood pressure that they couldn't receive medications for in the camps, or their care was interrupted for chronic disease, or they may have infectious diseases that were undiagnosed. For example, we had a family from the Central African Republic where the children had parasites and as a result were not growing, so the opportunity to connect immediately to care was important. And then there are other situations where the health conditions have to do with the trajectory of their migration, so amputations as a result of conflict that have not had the opportunity to have prosthesis or care for their amputations, or post-traumatic stress disorder and depression as a result of exposure to violence. So the third aspect of the Newcomer Health Program is advocacy. And one of the efforts that we've been involved with the community in is the National Day of Action. With the previous regime, I was going to say the previous government, we had draconian cuts to refugee health care. And so along with our community partners and with the medical students, we participated in the National Day of Action to protest that. And fortunately, this year, we've been able to have a reversal of those cuts to care. The fourth objective of the Newcomer Health Program is teaching of cultural competency. Even if we can address the needs of those at most need who are government-assisted refugees in their immediate health care, we won't be around forever, and it's very important for medical students and healthcare professionals to have the opportunity to learn cultural competency. So we've been able to do that in the clinic environment, but also with our partnership with CCLC, we now have a place within the curriculum at the medical school in the population health class where CCLC staff have participated in teaching medical students what it is to work in a culturally diverse environment. And now, with the arrival of the Syrian refugees, we had to kind of step back and see what our role needed to be. With the large numbers of people arriving in a short time, we actually disbanded the clinic and took on a more administrative role. And this will segue into Dr. Levacy, who will talk about our response to the Syrian refugees and further directions.
So for the Syrian Arrival, I'll just briefly outline sort of what went on and where things currently stand. So we had, again, great response from multiple organizations in the community, including the hospitals, who contributed staff to the team at the London Intercommunity Health Centre. So there was a multidisciplinary team led by nurses, and there were nurse practitioners as well, who would visit the lodging sites, so the hotels where a lot of the government-assisted refugees went upon arrival. And so they did mobile clinics there to assess for health needs. To this date, Dr. Blair Pierce, we want to acknowledge as well. He's a family physician who's been really tireless in continuing to see patients on an as-needed basis at the Cross-Cultural Learner Center as well. As the arrival numbers have sort of have slowed down, again, as Booma said, we're looking at reinstating the clinic in the way we used to, but also, again, we've built the network in terms of trying to build on the capacity in London. So we had a great response from the physician and nurse practitioner community. So we have over 40 family physicians who have agreed to take on one or more newcomer families, many of them taking many more than that. And that includes each of the 3 academic family medical teaching sites, so the sites that are associated with the university where family medicine residents train. So we think that's really ideal as well. And the nurse practitioner-led clinics, the Health Zone Clinic, is also involved and has been seeing a lot of newly arrived families. So again, when the arrivals were sort of at their peak, we were taking more of an administrative role. So we were helping to coordinate that network of healthcare providers. We had a healthcare provider education night in January, which was held at the CCLC and was very well attended. From that allowed us to develop what we're calling the London Refugee Health Network, so an email list and which connects people together. So we have, last I looked, 110 members, but that grows all the time. And that includes a variety of health professionals and other professionals who are working with refugee populations, probably many of you that are here today. And so through that, we can connect with each other, ask questions, distribute resources, and convey updates to that community. We also, in partnership with the Middlesex London Health Unit, developed a healthcare provider guide, so a PDF guide that healthcare professionals can use to guide their care of newcomers. And that prompts me to give credit again to those folks at the health unit, Joanne Simpson and Brooke and other people, as well as colleagues in British Columbia who we utilized a lot of their sort of their structure for the guide as well. We have a network of dentists led by Dr. Hassan Mustafa at Dove Dental. More recently, the London Regional Psychological Association has been involved, and they're very keen on building their capacity and in their members to be able to sort of step up to the needs that are relevant both for the Syrian refugees and for all newcomers. And at this point, again, we're hoping to reinstate the clinic sort of as we had it in the past. Now that the numbers have slowed down a little bit, we're hoping to continue to engage the physicians and healthcare professionals who've expressed this interest and to build capacity through further education nights. Advocacy, as Dr. Bayana mentioned, is an ongoing issue. So, I mean, we're very fortunate to have a lot of the health cuts reversed, but there are always needs that come up, for example, interpretation. We also, again, want to build our network and build on the momentum that we saw, as I'm sure everyone in the room really saw. It was just this incredible momentum with the Syrian response, and we're hoping to continue to engage people who are interested and to continue to build that to serve not only that population, but of course all newcomers. Thank you. I think we're open to questions if anyone has them.